Chances are, if you're watching this video, you are a runner. You play basketball, tennis, or cycle. You pretty much do whatever it takes to stay active and healthy. It keeps you young, and let's face it, sane. But unfortunately, you can get hurt. You could pull a muscle, you could sprain an ankle, or you could break a toe. Or you could develop that nagging, persistent injury with no history of trauma. For example, you get out of bed in the morning and your first step causes you pain in your heel. A mile into your run, the inside of your knee begins to hurt, or the outside of your hip becomes sore. Ever feel your feet get numb and tingly after 20 minutes on the bike or elliptical? Does your child complain that her feet are tired and her legs are fatigued after soccer, basketball, or dance? Hi, my name is Dr. Arthur Kaplan. I am a sports podiatrist at NY Sports Podiatry on the North Shore of Long Island, on Main Street, in Port Washington, New York. If any of the symptoms I just mentioned sound familiar to you, I can help. I can get you to run faster and jump higher, and most important, get you out of pain.
Good morning. Welcome to NY Sports Podiatry. Dr. Kaplan will be right with you. Please have a seat.
First thing that we do with a patient is go to the examining room and we do a full gait analysis. The first part of the gait analysis is what we call the static exam. I have Violetta here, who's a 31-year-old female. Violetta's complaining of pain on the inside of her left knee. It's been about 3 weeks and it occurs about a mile into the run. Sometimes Violetta can finish the run, other times she can't. The static exam includes measuring ranges of motion of the forefoot, the rear foot, how the rear foot interjects with the lower leg, the knee, and the hip. I will make range of motion movements on the right side, compare them to the right and to the left. I will also ascertain if there's any limb length difference in Violetta, because many times when injuries occur, mostly on one side, my knee bothers me on my left side, my hip, my back, all on the left side. Many times we look that one leg is longer than the other. Violetta's complaining of pain on the inside of her left knee, which could easily be caused from a limb length difference. Also could be caused by what's called a high Q angle. A high Q angle is the angle in which the upper leg makes with the lower leg. If it's too high, it's going to put too much torque on the knee, especially after repetitive running, as Violetta has been doing. This is the standing portion of the gait analysis. This part of the gait examination is critical. Violetta's chief complaint, her pain, is on the medial or inside part of the left knee. One of the things we look for in this examination is the angle in which the upper leg makes with the lower leg. It's called the Q angle. I could see without measuring that Violetta's left Q angle, the angle the upper makes with the lower, is much higher than it is on the right, which could be causing her pain when she runs. What we also focus on is the hips and the relationship between them and the relationship that they create with the shoulders. The hips should be equal. If we see one hip slightly higher than the other, it could be the reason why a patient complains of low back discomfort. Shoulders, again, should also be equal. I noticed by looking at Violetta that her right shoulder is a little higher than the other. Could be the reason, a compensation mechanism for her left knee pain. But we'll examine that further during the treadmill portion of our gait analysis. This is the critical portion of the gait analysis, where LED markers are placed on various anatomical locations of Violetta's body. The LED markers, with cameras placed in 3 different sections of the gait lab, will pick up various angles, which we could use, put it in a computer, and analyze the data so that we could help with Violetta's pain. The bottom line is I can make you run faster and jump higher, and most importantly, run pain-free. If you're having pain while performing your sport, give me a call or drop me an email. I'd like to keep you moving, pain-free. And thanks for watching this video.